Hello everyone. So I'm making this video and I'm actually happy and excited because I got messages from people who've been able to secure interviews by following my previous videos on cover letter and CVs. So please watch those videos if you are applying for jobs after AMC 1 because they will help you get into the system. So here I have some of the messages that I received. So someone got shortlisted for an interview, and that was because they prepared the CV and cover letter as my advice. And then we have someone else who had the first interview call, and that after watching my video on how to make a good cover letter. So, and I have another two doctors who secured an interview with only AMC one. I don't have their messages here, but they secured the interview with AMC one, and the interview is coming soon. So I'm dedicating this video to all these amazing people who followed the videos and got interviews. So I will be doing a mock type of interview and how to answer the questions in a real interview. So that can help you in your preparation, guys. And I'm sure you will do great. So let's start. So the first question is that they usually ask in 90% of the interviews, why do you want to work in this hospital? So you have to give an answer of 2, 3 minutes. So I will give an example of which answers I would give. So first you say, hi, First of all, I'm really thankful for you guys or for you to give me this opportunity for this interview. I'm really interested in working in this hospital for four main reasons. The main reason is I have got in contact with other doctors who've been working in that hospital, and they really gave me amazing feedback about how approachable the are and how the supportive the environment is, and you always have someone around you to escalate. And I think that's really important for me to grow as a doctor. The second reason is because I know that there is a good teaching program and there is weekly session teachings, and then you have unit specific teachings, and then there are workshops and feedback from the seniors. And I look to work in a place where I can grow as a doctor and learn more. So having a structured teaching is one of the other reasons I want to join this hospital. The third reason is about long-term career. I'm someone who's interested in doing to become a physician. So I'm interested in doing the basic physician training, and I know these hospitals offer basic physician training. So I believe if I start working in this hospital, I will become familiar with the team, familiar with how the hospital works, and then prepare for my application for the basic physician training. And the last reason I would be saying is mainly for personal reasons. I have relatives and friends that live around the area, and it will be really significant for me to have emotional and emotional support around me and have people around me where I can spend time off work and grow my life as well in a personal way. So yeah, that would be my four reasons why I want to join this hospital. Perfect. So that would be an answer. So just just think about 3 or 4 reasons, make them in a structure and just say them, most importantly, you have to praise the hospital. You have to say they have good and supportive, and you also have to say they have good training and that the hospital fits your long-term career. So that are the main things to say in this question. Okay, perfect. So let's go for the next question. Tell us about yourself. Okay. So, hi, as I introduced myself earlier, my name is Shaima. I'm one of the IMGs. I did my med school in Spain and my internship in Spain, and then I moved to Australia. I did my AMC 1 in March 2024, and then I secured a job with AMC 1 in August, and I have been working in the system for about a year now. I have also passed my AMC 2 in my first attempt in November 2024, and that has helped me a lot in understanding the Australian medical healthcare system. Along with my clinical work, I also work in some projects that I worked previously in Spain. So I did a couple of research about angina in Spain, and that helped me understand how the research process work and how and how to conduct statistical analysis. But at the same time, I'm someone who's always motivated to learn and to grow. So I have been working as a teacher as well for AMC 1 and AMC 2 and helping other IMGs to get into the system. And the last thing I would say, so for more personal perspective, everyone would describe me as someone active, as someone always looking into challenges, and also someone who's always very joyful and smiley. And I think those are good qualities that I can bring to the team. So yeah. So again, you talk about, so in this question, in summary, you talk about your clinical work, what you have done. You have to try to highlight the big things you have done. To be honest, clinically, I don't have big achievements, but I just have a normal internship and I've been working in Australia for a year. But then also highlight if you have done any research, if you have done any teaching, which is really important, and then give us a little bit of informal way, tell about yourself. How do people describe you? And that's nice because it breaks a little bit the ice about between the interviewer and you, and just say, oh, I'm friendly, or I'm someone who's really motivated to do this, and just give a little thing about yourself as well. Perfect. Let's move to the next. So, patient admitted in the ward for the last three days, now becoming hypoxic and tachycardic. How do you manage? So, first of all, it's important for me to be able to recognize that this patient is having acute new symptoms that need prompt review. So I will go and review the patient and I will follow an ABCD approach. We'll make sure that the patient's airway is patent and make sure there is no obstruction in the airway and the patient is able to speak in full sentences. Then I will check the breathing, I will check the respiratory rate and the oxygen saturation. We'll quickly auscultate the lungs and see if there's any crackers or any decreased air sounds. And we start the patient on oxygen. I normally start with 2-liter nasal prongs. And then I will move on to see which is circulation. So let's check the blood pressure, the heart rate. Make sure the patient has got access and get some blood tests, get full blood count, urea, electrolytes, CRP, and also we'll get a D-dimer in this case. And then I will check the patient level of consciousness, check the pupils if they are reactive to light, check the glucose level, and also check the calves and see if there is any swelling or pain in his legs that could make me think about a DVT. My main differential in this case, or a patient who has been admitted for 3 days and now he is hypoxic and tachycardic, will be pulmonary embolism. So I will start ordering investigation. My main investigation in this case would be a CT pulmonary angiogram. But I'm also thinking about other differentials. So, for example, could be a pneumonia. So we'll also order a chest X-ray just to make sure there's any consolidation. And then we'll make sure the patient is check if the patient is febrile or afebrile. If the patient is febrile and hypoxic tachycardic, then I'm concerned about sepsis. So I know I need to start antibiotic within 1 hour, and I will escalate to my senior that we have an acutely ill patient that need prompt review from a senior as well. And that would be my main management in this case. So that's been a bit quick, maybe not the perfect way I have done it, but the idea is always, always, always be able to identify that it's an acute risk situation, acute situation. Secondly, always, always have an ABCD approach. Start your investigations, start your ABCD approach and management. And then the last one is always escalate to a senior. Okay, so that would be the main thing to do. So yeah, ABCD and then escalate to a senior, and then always in the beginning says, I'm aware this is an acute situation. So that would be how I do the clinical scenarios. And then, for example, we have another question. Tell us about a situation where you had a conflict with your senior. How did you manage? So you always give a real example, makes it nice. I remember once I was doing a night shift, so I'm explaining the situation. I was doing a night shift with my registrar, and we were in a surgical ward, and we had 2 patients who were deteriorating at the same time. So we had to make the decision how to, which patient to see first and which patient to see later. But then my registrar was thinking that she will be able to see both patients. So she wanted to see one patient first and both patients and the other patient in the second, later. But then I suggested that maybe it's easier if she delegates with me one of the patients and I go and I start an ABCD approach and start the investigations. Meanwhile, she can see the other patient. Initially, she disagreed, but with open communication and with voicing my concerns about patient safety, that the patient may deteriorate quickly, she agreed to the plan. So I went, I checked the patient, I did a full ABCD approach, I took some blood, and the patient was tender in his abdomen. So I was suspecting a perforation because they were admitted for a bowel ischemia. So I suspected that could have been perforated. So I ordered a CT abdo-pelvis with contrast. And at the same time, I was informing my registrar with everything I was doing, and she was agreeing to my plan. And the result is the patient came back from the CT. The CT was reported as a perforation, and he had to go to urgent surgery overnight. And we could tackle the situation in the minimum time possible because that been an urgent situation. So the results and the learning from this point is with open communication and not stressing out and conveying your concerns about the patients usually help in solving the conflict situations. So that's another example. So you have a conflict, how you do. So you manage a situation or a situation that you have had and you follow this structure. And the last question, your registrar is always coming late. How do you address this situation? So there is another structure that we can follow. So initially, if I see someone who's coming late or someone who's doing something against the guidelines, the first thing I will do is seek more information. Ask if there is any concerns or if any new challenges they are getting, or if there is any other things that may be maybe behind the reason of their coming late. And I will ensure that my registrar coming late is not impacting my patient safety. So I will make sure that my patient safety comes first, and will make sure that if there's any task that has been to be done by the registrar early and the registrar has not done it, I will be step and take the initiative to do those tasks if are within my scope. If I'm not able to do those tasks, I can always escalate to another senior, would be my consultant or another registrar, about my concern. Like, see, this registrar is coming late, and always we miss giving the insulin dose gets not charted, or any other concerns that I may have and I'm not able to help with. I will escalate it. And once this is escalated, we can have an open conversation with the whole team and try to see how we can offer support to the registrar. And if there is any adjustment we can do in the roster, or if there is anything that we can change so the registrar can make it on time. And that would be so, just very sensitive questions, very sensible answers. Always keep it very diplomatic. Seek information, make sure the patient is not having any harm, and the patient is safe. Show initiative, escalate, and always show support. So that's all my questions that I prepared today. There are many other questions that can get asked. So I think in my last video about interviews, I showed you one of those. So it's RMO interview questions. And there is a very nice, yeah, this one. So Advanced Med, this website has very good questions. So just prepare for these questions. They are the top 16 questions. So tell us about your experience. And then what's your long-term career and why this hospital? So we have covered those ones. So a member of the nursing staff complains that the intern is not attending the call and not doing duty properly. What will you do? So here I will use also the SPICE, structure. So seek information, patient safety, initiative, escalate, and support. And you got plenty of them in here. So just make sure you prepare all of them from this website. So you got 16. So you just have to say, just have to write Advanced Med RMO questions, and you get all of them. And just prepare your examples, give real examples, make it look nice. Dress appropriately for the interview, smile, don't get nervous. It's hard not to get nervous, but that's the way to prepare. Be very, very well prepared. Practice as much as possible, and interviews will go well. I hope this video been helpful for those who are preparing for interviews, and good luck, guys. Don't forget to subscribe to my channel. We'll make more other videos about more interview questions, and also I have another topics to cover, so they will become soon. And don't forget to follow my CV templates and cover letter when applying for jobs, because they work. Okay, goodbye. Thank you.